All right, good morning, everyone, and welcome. We will be speaking with three presenters today, Dr. Catherine Kasha, Dr. Jennifer Mintzos, and Dr. Stan Houston, and thank you for attending our platform launch. There we go. A reminder that we are recording this and it is running live. And so we encourage you, if you are not wishing to be seen, to turn your cameras off. And at the end, we will be doing our Q&A. And what we will do is request that you put your questions in the chat and I will read them out to the presenters. As an addition, to let you know, we will be providing you with a copy of the Zoom recording, which will provide the different viewpoints for you, one where you're just seeing the speakers and one where you can actually see the PowerPoint presentation as well. For the running of this presentation, what you will be seeing largely is the PowerPoint presentation, and then you can adjust at the end for your needs. We will run the presentation, which will probably take about 15 to 20 minutes, and then we'll have time at the end for questions. And as I said, type them into the chat, and then we'll provide you with the recording at the end. And so with that, I'll hand it over to Dr. Mintzos, who's going to do our land acknowledgement for us.
The Edmonton Zone Medical Staff Association and the Calgary and Area Medical Staff Society acknowledge that we are situated on Treaty 6 and Treaty 7 territory, Métis Nation of Alberta Regions 3 and 4, as well as one of the largest Inuit communities south of the 60th parallel. We respectfully acknowledge these are the traditional gathering places for diverse Indigenous peoples, including the Cree, Blackfoot, Métis, Nakota Sioux, Iroquois, Dene, Tsuut'ina, Ojibwe, Saulteaux, Anishinaabe, Inuit, and many others whose histories, languages, and cultures continue to influence our vibrant communities.
Thank you, Dr. Mintzos. We believe Albertans deserve the best healthcare from their government. This is a critical time to invest in Albertans and our health system. Our friends, neighbors, and communities are suffering deeply from the pandemic, exacerbated by cuts to and gaps within the system. Our next government must rebuild what was previously a top healthcare system in this country. The Edmonton Zone Medical Staff Association and the Calgary and Area Medical Staff Society established a working group with physicians from both primary care and specialty care working in hospitals in the community to design and administer a survey to our physician members. We absolutely acknowledge the needs we see in the system may well differ from the needs in rural areas. Government is encouraged to consult with a range of physicians, especially those in rural areas, to find innovative solutions for Albertans. The intent is to inform political parties running for government what physicians would want to see in their election platforms as this platform becomes the mandate and focus of the elected government for the next 4 years. Today, we present our recommendations from the healthcare platform in the upcoming 2023 provincial election based on our members' priorities. Lack of mental health care funding was a serious problem before the pandemic, and the need for care has increased over the last 2 years. The government must ensure sufficient and timely access to treatment. Supports embedded in the community foster stability and engagement for those suffering from mental health issues, which reduces reliance on costly emergency care. We recommend the following. Increase funding for and expand coverage of mental health services. Improve the delivery of mental health care through increased and varied points of access, such as community-based hubs. Increase supports for family physicians to better provide for patients within their medical home.
Pediatric mental health needs were immense prior to the pandemic and have only exploded since. Supporting the next generation's mental health must be a priority. We recommend the following. Increase funding and resources for pediatric mental health, including access to care through schools, in-school education to provide tools and strategies to better improve emotional health of children, and reverse changes to program unit funding, an early learning grant that provides early intervention resources to children with extra healthcare needs.
In the last 2 years, we've seen deaths due to opiate poisoning that have closely approximated the total number of deaths from COVID among Albertans. Yet while immense resources have been directed at COVID, entirely appropriately, of course, resources directed at prevention of opiate poisoning and opiate poisoning deaths have actually been reduced in some areas. And this crisis is largely due to the new appearance on the scene of drugs which are increasingly potent and of variable and unpredictable potency. So the opiate poisoning epidemic is a multifactorial crisis, and it requires a multi-pronged response. We recommend increased and transparent funding for an expansion of evidence-based addictions care and treatment programs, and addressing the opiate poisoning crisis by including evidence-based harm reduction strategies to prevent opiate poisonings and deaths.
All Albertans should have reliable access to local care for their reproductive health needs, including contraception, fertility management, STI screening, and all pregnancy-related treatments. Cost and travel should not be barriers to bodily autonomy and equitable access to standard level of care. We recommend the following. Initiate a provincial strategy to expand reproductive services with a focus on local and rural access. Provide free contraception.
Effective healthcare systems require collaborative relationships between healthcare professionals and their government. Our members support implementation of the following. Establishment of a transparent process for physicians to engage with government in good faith negotiations, including a bona fide mechanism for conflict resolution. Increased physician-government collaboration. And finally, reinstatement of good faith billing. Good faith billing is the government providing healthcare for Canadian citizens who do not currently have valid Alberta healthcare insurance.
The COVID pandemic has presented society with unprecedented challenges, and these have required decisions which balance health and health system issues with other social and economic issues, all in the face of limited and evolving knowledge. And so we recommend to establish the independent role of the Chief Medical Officer of Health in relation to the Health Minister and the Premier.
Albertans have, crumbling and understaffed hospitals ERs that are too small, understaffed, or closed, too few family doctors, unreasonable wait times for surgery, expensive and inadequate options for virtual healthcare, and inadequate options for long-term care, which has resulted in needless deaths of older Albertans throughout the COVID-19 pandemic. The healthcare infrastructure in Alberta, both in terms of facilities and personnel, needs a tremendous overhaul to better meet the needs of Albertans while improving sustainability. Our members recommend the following. Develop innovations that improve transitions between hospital, medical home, palliative care, and pre- and post-surgical care. To create strategies to allow aging in place and increase access to home-based palliative care services. Increase per capita primary care network funding to be used for direct patient care, as it has not been adjusted for inflation since 2013.
Deliver home care and long-term care through public facilities rather than via for-profit facilities to improve quality of care and reduce costs. Eliminate Alberta Health funding of for-profit corporations to provide virtual telehealth services. Increase and redistribute physician training spots among specialties to prepare for the projected needs of the population.
Build new hospital facilities to replace the deteriorating and inadequate hospitals, such as the Misericordia Community Hospital. Build new publicly delivered long-term care facilities to provide better care for the aging population and reduce pressure on hospitals and emergency departments. And finally, consolidate Alberta Health Services and Covenant Health to ensure equitable patient care and avoid duplication of administrative systems.
All right, and again, a reminder that we will be providing a copy of the slide presentation as well as a copy of the Zoom recording when we're done. And if you have any questions or wish to see any further information, you can always check us out on our website. And so that concludes our PowerPoint presentation, and we'll now open it up for questions. And again, a reminder to type it into the chat, and I will direct them to the doctors. And I'll give you a minute. I know it can take a moment to type. There we go. All right,
Sure.
so could you go over how you identified these areas as priorities?
I'll go ahead and take that. So what we did was we had a committee. We have 4 doctors who are primary care based, but in different areas, and 4 specialty physicians. And we met for quite a few meetings actually, to kind of go where we saw the healthcare system needs were. There was a fair bit of debate back and forth. Over time, we developed a set of questions, and then these questions went out in a survey to the membership where they could rank how much they supported or didn't support the priority. And then based on the results from the members, we then wrote up the healthcare, the platform you see today.
All right, I'll give one more moment for typing of questions, and then other than that, we will bring it to a conclusion. While we're waiting, I will just take this opportunity to thank our presenters today. You have all done a wonderful job, and thank you for your hard work on this very important moment here in our turning point for Alberta healthcare. And so with that, unless there are any other questions, I think we will bring this to a conclusion. And of course, you can always email us if you think of anything after, once we're sending out the recording and the materials to you. Okay, well, I guess we will call that a wrap then. Thank you everyone for attending, and we look forward to discussing any other questions you have later.
Thank you.